So let's return to this story of YouTube launching a verification system, particularly for healthcare workers in the UK as it battles disinformation online. In 2022, health videos were viewed more than 3 billion times in the UK alone on the video sharing platform. Doctors, nurses, psychologists have been applying for the scheme since June and must meet rigorous criteria set by the tech giant to be eligible. Successful applicants will have a badge under their name identifying them as genuine or a licensed healthcare worker. There's much more to this story, of course. Let's speak to Sander Van Der Linden, author of Foolproof: Why We Fall for Misinformation and How to Build Immunity. Sander, good afternoon to you.
Good afternoon. Thanks for having me on.
It's a pleasure. Nice to have you with us. I mean, we often use that term, it's a minefield out there, but man alive, it really is. Yeah, I mean, we know 10 years ago, whatever, a little more than that, we didn't have YouTube, certainly not this, we didn't have social media on this scale. And now everyone has an opinion, everyone has the conch, everyone has, it seems, views and opinions on whatever subject you care to mention. It's finding the truth in that melee of voices that's become the problem. And within that melee of voices, of course, are people who just make it up.
Yeah, absolutely. When you think about news media more generally, I mean, a lot of it is professionally produced, even regulated. But with the onset of YouTube, anyone can make a video and make up anything and release it on the platform. And that's been a huge challenge.
It's interesting, isn't it? I often challenge people. Sometimes I've done it online and, somebody has sent me a video of, COVID being an obvious area where misinformation was rife. And somebody will say, why are you not reporting on this? And it'll be a video of a doctor saying, COVID was a scam and there's no proof of it and you've been lied to and Pfizer are planning to cull half the planet and all this kind of nonsense. And the first thing I often wonder, Sander, is this. Why would somebody choose to believe that voice as distinct from the 10,000 other voices that are saying the opposite? Now, of course, the lone voices, there's more than one. But I would say for every one lone voice on something specifically like that, there's thousands of other voices, qualified voices, certified voices that say something different. But for some reason, it's the outlandish interpretation or the outlandish view that has got more hits than all the others.
Yeah, to some extent, that depends on the degree to which that information resonates with what people want to believe or may have heard from others. And so YouTube's algorithm at least used to play a role in that too. So it recommends videos that have a higher chance of being watched. So if you select a video that is not entirely, a hoax, but somewhat questionable, it then notices that you engage with this type of content and it will ramp up the types of videos also in terms of extremity that you'll be exposed to. And of course, there's no way for people to quickly verify the credentials of the individuals who are providing the content. Because when we deal with information, we rely on heuristics, rules of thumb, right? Oh, this person is saying something that resonates with me, with what I've heard in my own social circle, so it must be true, which then makes it less likely that people go out and fact check and do more research.
That's
and
true.
So in the moment, on social media, this lack of verification causes a lot of confusion about what voices are trusted and reliable. So I think this new initiative we should welcome.
It's interesting because that algorithm that you mentioned there almost compounds the problem, doesn't it? Because those videos end up with 20 million views, and that in itself is then used as evidence as to why it might be true. And you often see people say, look, 20 million people have seen this, they can't all be wrong, etc. And of course, that doesn't intellectually work, but it is certainly impressive in terms of numbers, and it thrives and grows the echo chamber, because that's really what we're dealing with here.
Exactly. It's what we call social proof, which is much more powerful to most people than scientific proof. Because, if everyone's watched it, that's a cue that it must be engaging, it must be interesting. And as you said, the huge issue is echo chambers, where people are selectively surrounded by content and get the impression that it's the norm, that other people believe it, and that this is the type of information that we need to engage with. And it becomes very difficult to pierce that echo chamber with information that runs contrary to what people have been exposed to. And that's cognitively much more complex for people to then deal with. If you've already accepted a viewpoint, updating your beliefs, something that runs contrary to that, is just more complex than already going ahead with what you thought was true anyway.
There is perhaps a troubling side when it comes to freedom of speech and expression. It may well be that I want to make a video simply raising some genuine questions about something, about a medicine or a vaccine or a pharmaceutical company. I might have huge question marks genuinely over one of the big pharma corporations. I would stand a danger then if I posted that under this guidance of either having my video refused completely or having it relegated to such a degree that it never gets seen. And that could be seen as a large Silicon Valley corporation like YouTube controlling what we're allowed to think or believe.
Yeah, well, I think we have to view it in the sort of the toolboxes that they have available. And I think to some extent, before they were taking down content, they said they would just take all vaccine misinformation down during the pandemic. There was just a big article recently about how most social media companies are dialing down moderation, getting rid of human moderators, and actually doing less and less about misinformation. And so this new initiative I thought was interesting because it's trying to find a balance between allowing people to speak, but not mislead people or actively mislead people. And so there's going to be cases that are up for discussion, I'm sure. But I think if I understand this new initiative correctly, what they're doing is that you can't, because my concern would be that actually you could cheat the system. It also, like if you're a doctor, let's say, and your expertise is allergies, and now you're going to talk about something that's completely outside of your expertise, that is also what we would call questionable. And you could do that because you can get licensed. So I was happy to see that they are then saying that if you step outside of your domain of expertise, you'll be reviewed. And if you spread disinformation in the past, that might also compromise your ability to get verified. So I think there are sort of guards in place here that should help steer things in the right direction. But at the end of the day, this is not taking away people's speech, right? It's simply saying these sources are verified by official organizations, and other sources are not, and people are still free to upload a video on YouTube and say anything. It's just that they don't have a verified mark.
Indeed. Sander, thank you for your time. Sander Van Der Linden, author of Foolproof: Why We Fall for Misinformation and How to Build Immunity.